Number 10. Fentanyl overdose. Why it's number 10, at least it's over fast. Relative to everything else on this list, fentanyl is practically merciful. That's how bad the rest of this list gets. Picture this. It's 2019, you're at a party. Someone hands you what looks like a regular painkiller, a small white pill. You take it. You don't know that this pill contains fentanyl, a synthetic opioid 100 times more potent than morphine. You find out 20 minutes later when you stop breathing, fentanyl is so potent that a dose the size of a few grains of salt can kill a grown adult. So potent that police officers have overdosed just from touching residue on a surface. So potent that it has killed over 150 Americans every single day since 2021. And here's the dark irony. Most of its victims didn't know they were taking it. Fentanyl hits your opioid receptors, the ones in your brain that control pain and breathing. Within minutes, those receptors are completely flooded. Your brain gets a signal. Stop breathing. Not slow down. Stop. Your chest muscles lock up. This is called wooden chest syndrome. Your ribcage literally becomes rigid, like someone filled your chest with concrete. You can't inhale. You can't exhale. You're awake for some of this, then you're not. Your oxygen levels drop. Brain damage begins within 4 minutes. Death within 10. Your lips turn blue. Your body goes limp. If no one is around with the naloxone, the reversal drug, you don't wake up. This is the cruel part. It doesn't feel bad at first. Opioids flood your brain with dopamine. The last thing most fentanyl overdose victims feel is warmth, euphoria, like every problem in the world just dissolved, and then nothing. The brain starts shutting down. The warmth becomes darkness. You don't feel the chest locking up because you're already going under. In many cases, victims are found in the position they were sitting, phone in hand, mid-conversation, mid-bite of food. They didn't know. That's what makes fentanyl so uniquely sinister. It doesn't announce itself. It doesn't give you time to call for help. It just turns the lights off. Why it's number 10? It's number 10 because it's fast. 10 to 20 minutes from the first pill to death. Compared to what's coming on this list, deaths that take days, weeks, even years, fentanyl is almost a kindness. Almost. You still suffocate. You still die completely unaware. You still leave behind people who had no warning. Number 10, not good. Just less terrible than everything below. Number 9, alcohol overdose. Why it's number 9, you're conscious longer than fentanyl, and the method of death is significantly more undignified. It's a Friday night in college. You're 19. It's your birthday. Your friends think it's hilarious to do shots every time someone says your name. An hour later, you've had 14 drinks. You think you're fine. You're laughing. You're standing. You're not fine. Your blood alcohol content is now 0.30, 3 times the legal limit. At 0.40, your brainstem stops regulating breathing. At 0.45, cardiac arrest. You don't make it to 0.45 because something else happens first. You throw up. You're unconscious. The vomit goes the wrong way. This is how most alcohol overdose deaths actually happen. Not from the alcohol directly, but from aspiration. Drowning in your own stomach contents while your brain is too suppressed to cough. What actually happens? Alcohol is a central nervous system depressant. At toxic doses, it systematically shuts down every function your nervous system controls. First, your coordination goes. Then your judgment. Then your speech. Then your gag reflex. Then your ability to stay conscious. Then your ability to breathe. The vomiting is your body's last attempt to save itself, expelling the poison before it kills you. But if you're unconscious when it happens, there's no gag reflex to clear your airway. The vomit enters your lungs. Aspiration pneumonia develops within hours. Your lungs fill with fluid. Or your brainstem simply stops signaling your diaphragm to contract. Either way, the result is the same. Respiratory failure, hypoxia, brain death. What it feels like. The problem with alcohol overdose and why it kills so many people who could have been saved is that the victim usually feels great right up until they don't. The euphoria of heavy drinking masks all the warning signs. You feel warm, invincible, everything is funny. Then the room starts spinning and you can't stop it. Then your body makes the decision to lie down and you can't argue with it. Then you're on your back and you're spinning and you're nauseous and you think you should probably tell someone but you can't form the words, and then you wake up in a hospital. Or you don't wake up at all. There's no middle ground. And the worst part? The people around you thought you were just very drunk because you looked just like you were very drunk. Why it's number 9? Number 9 because there's a window where you could be saved. Naloxone doesn't work on alcohol, but positioning someone on their side, keeping their airway clear, calling emergency services, these work. Fentanyl gives you almost no window. Alcohol gives you one. Most people just don't realize the window is closing until it's shut. Number 8, burned alive. Why it's number 8, your body actually runs a protection program. It partially works. It's still absolutely terrible, but the smoke usually gets you before the worst of it. Usually, it's 3 a.m. You're asleep. A faulty wire in the wall of your apartment has been smoldering for 2 hours. By the time you smell the smoke, the hallway is already impassable. The window is your only option. You're 4 floors up. The fire reaches your room. You have approximately 90 seconds before the smoke incapacitates you. This is how most people die in fires. Not from the flames, but from the smoke. Carbon monoxide poisoning, cyanide from burning synthetics. Your blood stops carrying oxygen. You pass out. And then the fire arrives. If you're lucky, you're unconscious before that happens. If you're not lucky, we have a very different conversation. What actually happens? Third-degree burns destroy all 3 layers of skin: epidermis, dermis, subcutaneous tissue. They also destroy the nerve endings in that area. This is why severe burn victims often report that the most burned areas actually hurt less than the edges. The worst areas have no nerves left to send signals, but before you reach 3rd degree, you go through 1st and 2nd. 1st degree, intense pain, redness, like severe sunburn, multiplied. 2nd degree, blistering, fluid beneath the skin, excruciating pain. The transition from 2nd to 3rd takes seconds in an actual fire, but those seconds exist. Your lungs are also burning from the inside. Superheated air causes thermal injury to your airway. The tissue swells, your throat closes. Even if the fire doesn't directly kill you, your swollen airway will. What it feels like. The first few seconds of serious burns are surprisingly survivable in terms of pain. Adrenaline floods your system and partially blocks the signal. Then the adrenaline wears off. The pain that arrives is described by burn survivors as unlike anything else in human experience. Not sharp like a cut, not aching like a bruise. It's a total sensory override. Your entire nervous system is screaming at maximum volume and there is no way to turn it down. Most fire deaths involve smoke inhalation first. You lose consciousness before the worst burns happen. This is merciful, but not universal. There are documented cases of people surviving long enough to experience the full progression. Those survivor accounts are some of the most harrowing documents in burn medicine. Why? It's number 8. It's number 8 because smoke usually wins the race. The majority of fire deaths are from smoke inhalation before severe burns, meaning unconsciousness comes first. Compare this to what's coming later on this list, where you are awake and aware for the entire experience and burning alive starts to look relatively humane, starts to not actually.
Number 7. Eaten alive. Shark crocodile. Why? It's number 7. The terror component. Your brain knows exactly what is happening to you and can do absolutely nothing about it. You're swimming off the coast of South Africa. It's beautiful. Clear water, warm sun, 3 meters of visibility. You don't see the great white shark until it has your leg. The bite force is 4,000 pounds per square inch, roughly equivalent to being hit by a small car. The first bite doesn't kill you. The blood loss from the first bite will. Or you're a tour guide in Zimbabwe, leading tourists near a river. You've done this 1,000 times. The crocodile that grabs your arm has been waiting motionless for 4 hours. It weighs 600 kilograms. Its death roll, the spinning motion used to disorient and drown prey, generates forces that dislocate your shoulder in the first rotation. In both cases, the attack takes seconds. The dying takes longer. What actually happens, shark? A shark attack involves massive tissue trauma and blood loss. The shark's teeth are serrated. They don't just bite, they saw. Large vessels are severed instantly. A bite to a major artery, femoral, brachial, can cause fatal blood loss within minutes. Hemorrhagic shock sets in fast. Your blood pressure drops, your heart beats faster trying to compensate. Your vision narrows, you go cold. The shark may bite once and disengage. Many attacks are investigatory bites, the shark realizing you're not its preferred prey. This is cold comfort when the investigatory bite has removed your leg. What actually happens? Crocodile. Crocodile attacks are in many ways worse than shark attacks because crocodiles are patient and methodical. The death roll is designed to disorient, exhaust, and drown. They drag you underwater. They may wedge your body under a log to let you tenderize. Crocodile stomach acid pH is around 2, close to battery acid. If you survive long enough to be consumed, the digestive process is not quick. What it feels like. Survivors of both types of attacks report a common initial experience. The impact is so massive that the first moment is almost painless, pure shock and disorientation. The brain needs a second to process what just happened. Then the pain arrives, described as crushing, tearing, burning simultaneously. The psychological component is unique to predator attacks. Your brain understands that you are prey, that a living creature is actively eating you. The primordial terror this activates is a category of fear that most modern humans never encounter, and that no other kind of death on this list produces. Why it's number 7. The speed of blood loss can be merciful. Major vessel damage brings unconsciousness within minutes, but the conscious window, the period where you know exactly what is happening to you, is uniquely psychologically devastating. It's number 7 because there are deaths lower on this list where that conscious window extends for hours, days, or decades.
Number 6. Radiation poisoning. Why it's number 6. 3 weeks of your body eating itself from the inside, while you're fully aware, while the doctors can do almost nothing. And the first 2 days feel fine. It's April 26, 1986. You're a Chernobyl firefighter. You've been called to deal with what they're calling a routine reactor fire. Nobody tells you the reactor has exploded. Nobody tells you that you're absorbing 16 grays of radiation, 8,000 times the safe annual dose, in the first hour. Nobody tells you that the burning sensation in your throat is your mucous membranes beginning to die. You feel fine that evening, a little nauseous. You vomit once and go to sleep thinking it was a rough shift. You wake up the next morning and feel mostly okay. This is the cruelest part of acute radiation syndrome. The initial exposure period is followed by a latency phase where you feel almost normal, and then your body falls apart. What actually happens? Radiation damages DNA at the cellular level, but different cells have different lifespans. The damage doesn't show up immediately. It shows up when those cells try to divide and replicate their broken DNA. Gastrointestinal cells divide every few days, blood cells every few weeks. This is why radiation sickness progresses in stages. Stage 1. Your bone marrow stops producing white blood cells and platelets. Your immune system collapses. Your blood can no longer clot. Stage 2. Your gastrointestinal lining breaks down. You develop severe bloody diarrhea. You can't absorb nutrients. You're starving even while being fed. Stage 3. With no immune system, every bacteria and fungus that normally lives harmlessly in your body becomes a lethal infection. Your skin breaks down. Your hair falls out in fistfuls. Internal bleeding appears as bruises across your entire body. What it feels like. The Chernobyl firefighters reported that their skin felt like it was burning from the inside, a deep bone-level heat that no painkiller could reach. Their hands and faces turned black with radiation burns while they watched. They could feel their gums dissolving. Teeth fell out not one by one, but in sections. Alexander Litvinenko, poisoned with polonium-210 in 2006, spent 23 days dying in a London hospital. He described the experience as feeling like his body was being dissolved from the inside. He lost all his hair. He weighed less than 40 kilograms when he died. He was conscious and lucid until very near the end. He knew exactly what was happening to him and who had done it. Why it's number 6. 3 to 4 weeks of progressive systemic destruction while fully conscious. Number 6. Because there are deaths on this list that last even longer, with even more psychological torment. But radiation poisoning earns its place for the combination of duration, visibility, you watch your own body fail piece by piece, and the complete helplessness of modern medicine to do much more than manage symptoms. Number 5. Bleeding out slowly. Why it's number 5. You are completely conscious. You know exactly what is happening. You feel every single minute of it. And there is nothing anyone can do. You've been in a car accident. The impact ruptured your spleen, an internal organ you can't see and can't feel directly. You walked away from the crash. You told the paramedics you were fine. You feel shaken, a little sore, but fine. You decline the hospital. 3 hours later, you're lying on your kitchen floor. You tried to call 911, but you can't get up. Your abdomen is filling with blood. Your blood pressure is 60/40. Your body is in hemorrhagic shock. You have been bleeding internally for 3 hours, and you thought you were fine. You have maybe 20 minutes. What actually happens? The body has 4.7 to 5.5 liters of blood. Hemorrhagic shock begins at 15% blood loss, roughly 750 milliliters, about a large soda bottle. At 30% loss, your heart rate spikes, your blood pressure drops, your kidneys begin to fail. At 40%, roughly 2 liters, cardiac arrest becomes likely without immediate intervention. Your body's compensatory mechanisms are remarkable and horrifying in equal measure. As you lose blood, your blood vessels constrict, squeezing the remaining blood towards your vital organs. Your heart beats faster. Your breathing quickens to maximize oxygen extraction from each breath. Your body is fighting for you with everything it has. For a while, these mechanisms mask how critical your condition truly is. Then they fail. What it feels like. Trauma surgeons describe hemorrhagic shock as one of the most insidious forms of dying because the patient often doesn't realize how close to death they are until the final stages. The initial blood loss produces anxiety, restlessness, a sense that something is wrong, but not agony. Your body's adrenaline response masks the worst of it. As blood loss progresses, the cold sets in. It starts at your extremities. Your hands and feet become cold as blood is rerouted to core organs. The cold creeps inward. Your vision narrows. Peripheral vision goes first. Then your visual field shrinks to a tunnel. Sounds become distant, muffled, like you're hearing them from underwater. Hearing is the last sense to go. Patients who have been resuscitated from severe hemorrhagic shock describe hearing voices and sounds clearly when they could no longer see or respond. And you are aware throughout most of this. You can think, you know what is happening, you just can't stop it. Why it's number 5. The conscious awareness combined with the relatively slow timeline, 20 minutes to hours depending on the bleed, earns this its place at number 5. The physical experience is not the worst on this list. The psychological experience of lying there, aware, knowing, watching your vision narrow, and feeling the cold creep toward your heart, that's what puts it here. Number 4. Eaten alive by fire ants. Why it's number 4. Every sting is individual. There are thousands of them. They don't stop. And historically, humans have used this as an execution method, on purpose, for enemies. In 2013, a man in South Carolina was found dead in his home. He had fallen and couldn't get up. Fire ants had located him. By the time he was discovered, thousands of fire ants had been stinging him for hours. The official cause of death was anaphylactic shock from multiple fire ant stings. The estimated number of stings on his body was over 1,000. This was not a historical anomaly. Fire ant deaths are documented across the American South and increasingly in Asia and Australia as the species spreads. They're especially dangerous to the elderly, the immobile, infants, people who cannot escape, and in the ancient world, this wasn't an accident. It was a sentence. What actually happens? Each fire ant sting injects a venom called solenopsin, an alkaloid compound that causes immediate burning pain, then a white pustule, then itching that can last days. A single sting is unpleasant but manageable. 100 stings cause significant pain and localized tissue damage. 1,000 stings cause systemic poisoning. But the more dangerous mechanism is anaphylaxis. Fire ant venom contains proteins that trigger IgE-mediated immune responses in sensitized individuals. Roughly 1 to 2% of people are severely allergic. For these people, a few dozen stings can trigger anaphylactic shock. Blood pressure collapses. Throat swells. Breathing becomes impossible without epinephrine. Even without severe allergy, mass envenomation from hundreds of stings causes widespread tissue destruction, severe electrolyte imbalances, renal failure, and cardiovascular compromise. What it feels like. Fire ant survivors describe the initial stings as hot needles, each one individually, then a burning that layers on top of the previous burning. As the sting count rises, the sensation stops being localized and becomes total. Your entire body is on fire simultaneously. The historical use of this as execution is particularly illuminating. Multiple ancient cultures. Various warrior societies across Africa and the Americas used ant-based tortures precisely because The experience was impossible to ignore, impossible to habituate to, and left the victim fully conscious throughout. The body cannot adapt to thousands of simultaneous injury signals. Every single one registers at full intensity. Why it's number 4. The combination of simultaneity and duration. Each sting is a separate, individual pain event. There is no overload effect where the pain becomes noise. The body processes thousands of simultaneous insults at full intensity. The complete helplessness. You cannot fight an ant swarm. You cannot negotiate with it. You can only endure it. Makes this number 4 on the worst deaths list. And the fact that someone, somewhere, thought this was a proportionate punishment for another human being makes it even worse. Number 3. Dying from rabies. Why it's number 3. 99.9% fatal once symptoms start. You are fully conscious while your brain is eaten alive. You develop a terror of water so severe that the sight of a glass sends you into violent convulsions. Fewer than 15 humans have ever survived in all of recorded history. 2 months ago, you found a bat in your woods. It bit you. Small bite, barely bled. You forgot about it. Yesterday, the old bite site started tingling. This morning, you have a fever. Tonight, the nurse tries to give you a glass of water, and something happens. Your throat seizes. Not tightens, seizes. Violent, involuntary, complete. You didn't choose to react this way. You can't stop it. The sight of the water, the sound of it, even thinking about it triggers the same response. This is hydrophobia, the hallmark symptom of late-stage rabies. Your brain has been rewired by a virus to be physically incapable of drinking. You have 12 days, and you will be awake for most of them. What actually happens? The rabies virus doesn't travel through your bloodstream. It hijacks your peripheral nervous system and travels along your nerve fibers toward your brain, 12 to 24 millimeters per day, invisible to your immune system, completely undetectable until it arrives. By the time it reaches your brain, your immune system has already lost. The battle it mounts, the inflammation, is part of what destroys you. The virus specifically targets your limbic system, the primitive, emotional brain, the part that controls fear, aggression, and basic survival drives. This is not random damage. The virus systematically destroys the parts of you that make you human, while leaving enough of your higher brain intact for you to watch it happen. What it feels like. Lucid intervals are the worst part. Between episodes of violent convulsions and hydrophobic spasms, you return to yourself. You understand where you are. You can see the fear on your family's faces. You can look at your own restrained wrists and understand why the restraints are necessary. You can feel your mind slipping away, and you cannot stop it. The hydrophobia feels involuntary and alien. Your body doing things your mind did not authorize. During an episode, you thrash, you bite, you foam, you scream. During lucidity, you know exactly what you looked like during the episode. The psychological horror of losing control of your own body while fully conscious is a category of suffering that almost no other disease produces. The fatality rate, once symptoms begin, is 99.9%. Fewer than 15 people have ever survived symptomatic rabies in recorded history. And it is entirely preventable with a vaccine that costs less than a cup of coffee. Why it's number 3? Number 3 because the conscious window spans days. The psychological destruction is uniquely terrible. And the specific symptom of being afraid of water while desperately thirsty is a detail so horrific it reads like fiction. It doesn't make number 1 or number 2 only because the total duration, 2 to 12 days, is shorter than what comes next. For a death that lasts years, we go higher on the list. Number 2. Dying from tetanus. Why it's number 2. Every muscle in your body contracts at full force simultaneously, for weeks. You cannot eat, you cannot sleep, you cannot breathe. You are fully conscious for all of it. A rusty nail did this to you. It's 1910. You're a farmer in rural Ohio. You stepped on a rusty nail 3 days ago. Cleaned it, bandaged it, didn't think much about it. This morning your jaw feels stiff. By evening you can't open your mouth fully. By tomorrow you'll understand why they call this lockjaw. Tetanus vaccination won't become standard until the 1940s. There is no treatment that can stop what is already happening inside your nervous system. The bacterium Clostridium tetani, which was living in the rust and soil on that nail, has been producing a toxin called tetanospasmin for 3 days. That toxin has been traveling up your motor nerves to your spinal cord, and it has arrived. You have 2 to 4 weeks of this ahead of you. Every single day of those weeks will be worse than the day before. What actually happens? Tetanospasmin is one of the most potent toxins known to science, second only to botulinum toxin. It works by blocking the release of inhibitory neurotransmitters in your spinal cord. Your motor neurons, the ones that tell your muscles to contract, normally have an off switch. Glycine and GABA release keeps them from firing continuously. Tetanospasmin permanently blocks this off switch. Without inhibition, your motor neurons fire constantly. Every muscle in your body receives a continuous contraction signal. Your jaw locks shut, trismus, the signature early symptom. Then your facial muscles contract into a permanent grimace, risus sardonicus, the sardonic smile. Then your back muscles contract so powerfully that your spine arches backward, lifting your body off the bed in a rigid arc. Opistotinus. Your heels and the back of your head are touching the mattress. Your body is a bridge. This can fracture your own vertebrae. The diaphragm and chest muscles are next. These control breathing. When they go into sustained spasm, you cannot inhale. Respiratory failure is the most common cause of tetanus death. What it feels like. Every single spasm is exquisitely painful. Each one arrives like a full-body cramp, except every muscle, simultaneously at maximum force. Tetanus survivors, and there are some, from the post-vaccine era, when aggressive ICU management kept them alive through the worst of it, described spasms as the most intense pain they have ever experienced, arriving up to 50 times per day. And here's what elevates tetanus into the top 2. You cannot sleep. The spasms don't pause for rest. The slightest sensory stimulus, sound, light, touch, triggers another episode. Patients in the pre-antibiotic era were kept in darkened, silent rooms because a door slamming could trigger a spasm severe enough to break bones. You are in agony, you are exhausted, and you cannot sleep. For weeks. All of this while fully conscious, with no mental impairment whatsoever. Your mind is completely intact. You understand exactly what is happening to your body. You experience every spasm with full cognitive clarity. Why it's number 2 and not number 1? Because tetanus lasts 2 to 4 weeks, maximum. The suffering is extraordinary, the most physically agonizing death on this list, but it has an endpoint measured in weeks. What takes number 1 on this list has an endpoint measured in years, a decade of losing your mind. Compared to that, and only compared to that, 2 to 4 weeks of physical torment edges out. Number 1. Dying from syphilis, neurosyphilis. Why it's number 1. 10 years. It takes 10 years to kill you. And the whole time, you are awake, aware, and slowly watching yourself disappear. It's 1925. You had a good time at a speakeasy. 3 weeks later, a small painless sore. It went away. A few months after that, a rash, some flu symptoms. Those went away too. For the next 10 years, you felt completely fine. You worked, you got married, you had children, you lived your life. Then, a decade after a single night you barely remember, you're sitting in a doctor's office and he's telling you that you have tertiary syphilis. The bacteria has been in your brain for years. It's been building lesions, microscopic damage, systematically destroying your neural tissue. The headaches you've been having, the memory lapses, the personality changes your wife noticed, the tremor in your hands. That's not stress. That's your brain being eaten. You have maybe 2 years, but they won't be good years. What actually happens? Treponema pallidum, the syphilis bacterium, is extraordinarily elegant in its destruction. After the initial infection and the brief symptomatic stages, it enters a latent phase that can last years or decades, silently colonizing your organs. In the brain, it forms gummas, inflammatory lesions, and damages the cerebral cortex, the meninges, and the blood vessels. The resulting neurosyphilis systematically destroys everything that makes you who you are. First to go, personality. The prefrontal cortex, responsible for impulse control, judgment, and social behavior, is one of the first casualties. You become irritable, paranoid, grandiose. You make decisions that the old you would never make. You say things you would never have said. the people who love you watch a stranger wearing your face. Then memory, then coordination, gait ataxia, you walk like you're drunk when you haven't had a drop. Intention tremors, your hands shake when you try to do something precise. Dysarthria, your speech slurs. All while your mind remains aware enough to notice that something is very wrong. What it feels like, year by year. Year 10 after infection. You notice the headaches, the forgetting, you snap at your kids for no reason, you get lost walking a route you've walked 1,000 times. Year 11. You know something is wrong but you can't articulate what. Your wife is scared of you, your handwriting has become illegible. You've been diagnosed, you've started treatment, it's not working. You swing between episodes of grandiosity, convinced you're brilliant, destined for greatness, and crushing despair. You cry without knowing why. You rage without knowing why. Year 12. You're in an asylum, not voluntarily. You attacked someone during a paranoid episode. You're in a room with other men in the same late stage of neurosyphilis. Some of them don't speak anymore. Some of them speak constantly, to people who aren't there. You have windows of clarity, where you understand exactly where you are, and what you've become. These windows are the worst part. Year 13. The windows are mostly closed now. You live in a permanent fog, punctuated by moments of terrible clarity. Your family visits, but you don't always recognize them. Sometimes you're back in 1925 at the speakeasy, sometimes you're a child. Sometimes you're yourself, and you know what you've lost, and you can measure exactly how much of you is still there. Then, the windows close for the last time. You slip into a coma. Your autonomic functions fail, your heart stops, you are 37 years old. Why it's number 1. Every other death on this list has a definable endpoint, minutes, hours, weeks. Syphilis takes a decade, but it's not just the duration, it's what the duration contains. You are present for your own gradual erasure, you watch your personality change, you experience your memory disappearing. You have moments of perfect lucidity, where you understand exactly what you've lost and what is still being taken. The disease destroys the very cognitive architecture you would need to cope with it. Fentanyl turns the lights off in minutes. Tetanus destroys your body over weeks, but leaves your mind intact. Rabies takes your mind, but only over days. Syphilis takes your mind, your personality, your memories, your dignity, and your body, over 10 years, while giving you just enough lucidity to understand what is happening, and just little enough to stop it. That is why it is number 1. That is the worst way to die. So there you have it. 10 ways to die, ranked from bad to absolutely terrible. Fentanyl at number 10 because at least it's quick. Syphilis at number 1 because it gives you a decade to think about it. The good news, almost every death on this list is entirely preventable. Don't take unknown pills. Know your limits with alcohol. Don't go swimming near known shark zones. Get a tetanus booster. And if a bat bites you, go to a doctor the same day. Not tomorrow, the same day. Like and subscribe if you made it through all 10. And if you want to know what each of these deaths feels like in full detail, we have entire videos on most of them. Links in the description. Stay safe, make good decisions, and maybe see a doctor occasionally.